Hello friends, through this presentation I share with you some tips that can help you protect yourself when you are at home and also your family members. With COVID-19, it is very important to remember the standard precautions of hand hygiene, which means you wash your hands with soap and water whenever you've touched a surface or you've gone out and come back home. You need to practice social distancing and you need to wear a mask all the time that you are outdoors. When you reach home, please remember that you're possibly carrying infection back. What can you do to reduce the risk of passing on this possible infection to your family? Wash your hands for at least 40 seconds with soap and water. This is important because this eliminates most of the viruses that could be on your hand. When you do not have access to soap and water, use a sanitizer that has at least 70% alcohol. Please remember this alcohol is poisonous, should not be consumed. So keep it out of reach of children and this can catch fire. So again, be very safe in where you store it. Once you reach home and you washed your hands, the clothes that you wear again can be a potential source of infection. So advise your family to keep a bucket with soap powder and water ready. So remove your clothes, put it into that, soak it for some time, wash it and dry it in sunlight. The mask that has been provided to you from Shankara is a multi-layered special mask. Wash this with soap and water again if it is dirty. Do not put it in a washing machine. You can rinse it with Dettol water for a few minutes and dry it. Again, this mask should not be ironed because the polypropylene layer will get destroyed if you do that. So just hang it dry and use it the next day. When you have to go outside, like for example, to buy vegetables, please wear a mask all the time. Avoid crowds. Where possible, use digital methods of payment like your Paytm, your Beam, UPI, Google Pay, etc. Wash your hands as soon as you come back home. Wash all vegetables, preferably in baking soda and water. Your groceries can also be washed with water and baking soda before you can dry and store them. There is no evidence to support any restriction in what you can eat, but as a good habit, please eat something that is cooked, preferably something that is warm, that is always more hygienic in this time of the pandemic. You all will be invited to functions and festivals. Please avoid crowds. Where possible, do not attend. If you don't have a choice and you have to attend, don't take those who are elderly. Don't take children with you. When you are in this event and function, please wear a mask throughout. Practice social distancing, which means be 5 feet away from whoever else that is there. Once you are back, please inform your unit HR and unit leadership. They will determine if any quarantine is required to protect yourself and to protect the rest of your Shankara colleagues. I would recommend you not to go to any containment zone or to cross state borders for whatever the event or function may be. It could be a death, it could be a birth. It is important that we protect ourselves, our family, and our colleagues at this time. What can you eat and drink? There are no recommendations as such, but the Ministry of Health and Family Welfare, as a part of their Ayush advisory, has suggested certain norms which I share here. You can gargle with warm water 2 to 3 times a day. You can add salt or betadine mouthwash and gargle. You can add half a teaspoon of haldi in 150 ml of hot milk, which essentially is 1 glass of hot milk, and drink this once or twice a day. Drink warm water throughout the day where possible. Again, a recent research shows that if you do steam inhalation for 5 minutes, 3 times a day, it is supposed to reduce the risk of you contracting COVID. And even if you get COVID, it reduces the severity of symptoms. So gargle as often as you can, drink haldi and milk, drink warm water as much as you can, and do steam inhalation 3 times a day. What should you do with children? Children are going to be extremely bored. With them having to take on digital classes, again, their eyes are strained. So limit all electronic gadgets. When they are attending classes, again, recommend the 20-20 rule, which means for every 20 minutes that they view the screen, they take a break of 20 seconds where they look at an object about 20 feet away. Make sure your children spend 90 minutes in sunlight. This could be on your terrace. This could be in your balcony. If they are taking a walk, please make sure that they wear a mask. Do not take them wherever there are crowds. And for very small children, when they're wearing a mask, make sure adults are there. Children less than 3 years with a mask can feel very suffocated and they can panic. So it is very important for adults to supervise. And once you go home, once you've had your bath, once you've washed your hands, make sure that you spend time with them. Talk to them, play with them. They don't have friends at this time. So we need to play the role of a friend with our children. Guests should be avoided as much as possible. A lot of you will have people coming in at home to help you. It could be drivers, gardeners, or people to help you with domestic chores or family. As soon as they enter your house, please ask them to wash their hands with soap and water. If they have any cough, cold, fever, do not let them in. Keep them outdoors, talk to them and send them back. While they are at home, please maintain social distancing and wear a mask if possible. A number of you would be using online portals to buy products, online delivery platforms to order food. Again, in these scenarios, ask the person to leave the parcel at your doorstep. Open the parcel, remove the contents. If it is food, transfer it to vessels or to other containers. If it is grocery, etc., as I mentioned earlier, see if you can wash it with baking soda, dry it and stock it. Once you've done this, again wash your hands with soap and water. Preferably apply soap for about 40 seconds and then wash it off with water. What should you have at home? Make sure if you take any regular medications for your diabetes, hypertension, or for any other eye condition, you should have stock for 2 weeks so that if for any reason you have to go into quarantine, you are not stuck. Write the contact details of your unit HR, unit leaders, so that your family can reach out to us in any emergency. Preferably stock up dry rations again for 1 to 2 weeks. This will prevent you from having to go to shops frequently and reduce the risk of you getting infected. With COVID, there is a possibility that either us or our family member may become positive. If this happens, do not panic. Reach out to your CMO and unit leadership for guidance. We have spoken to hospitals nearby and we will be able to help you. Home quarantine would be allowed if you're young, if you don't have any other medical condition, and if you are asymptomatic. If home quarantine has to be done, identify a room with an attached bathroom, preferably if it has a television, so that the person being quarantined is cared for in that one room itself. If you can, organize for a pulse oximeter. The units have organized for pulse oximeters, so if you require home quarantine, we will lend them to you. This will help check your oxygen levels. Once the quarantine period is over, or even during the quarantine, disinfect the rooms with Lysol, like how we've been doing in the hospital, or you could use dilute bleach, which is sodium hypochlorite. As I mentioned again, isolate the person in a room with an attached toilet and follow the protocol that the unit HR and the leadership will advise for you to return to work once this quarantine period is over. So if anybody is home quarantined, you also should stay away from work and would need to be quarantined for the same duration. If you or your family member have to be hospitalized, what is it that you need to keep ready? Make sure that all your medical records are there. Make sure the prescription of any medicines that you regularly take is available. Your lab reports that shows that you are antigen or antibody or your RT-PCR positive is available with you. Make sure your insurance papers are available. A lot of you have been covered under a new policy by Shankara. Again, make sure that you have these details. It is good to carry a photo ID card along with you, a paper that has all your emergency contact numbers of your family as well as of your colleagues at Shankara. Carry your credit card, carry some cash, carry a power bank. If you're carrying your mobile phone or a laptop, get your data plan updated because you're going to be spending 14 days by yourself, so you need something to keep yourself distracted. The basics of a toothbrush, toothpaste, your shaving kit, a soap, shampoo, your comb, clothing for 10 days, towels, a sanitizer preferably, a small packet that has your washing powder that can help wash your daily wear, and a blanket should become a part of your kit that you pack and take along. So friends, with this, we hope you can keep yourself and your family safe. If there are any specific queries, do reach out to us as a part of the quality team or to your HR team, and we will try answering to you. Keep home, keep safe as much as possible. With this, we can make sure that neither us nor our family gets infected with COVID.